morning, Mr. Box. My name is Tiffany. I am going to be your nurse today. This morning we're going to be doing a dressing change on your central line. It would provide privacy, raise the bed. Alright, can I just check your ID band? Thank you very much. Right, we did hand hygiene. So this is a pretty easy procedure. We'll just get the dressing changed on your central line. It shouldn't take very long at all. Right. First, I'm going to put a mask on. I would also put a mask on the patient. After doing hand hygiene, I would put on clean gloves. Alright, we're going to start by just removing the old dressing. Alright, so I'm going to start at the edges. I'm going to take the greatest care not to disrupt the central line or pull on it or pull it out. As soon as I get the dressing off, I will inspect the dressing briefly, make sure that there isn't any drainage I need to be concerned about. I'll also inspect the line itself and the skin around the patient's line. Make sure with the line there aren't any kinks or links. Make sure the skin around it doesn't have any edema, no drainage, no reactions to the tape or the line itself. Make sure everything looks good. Then I will put everything together, all the old dressing, toss that, hand hygiene again. Right, then I will get my kit ready, pull out the sterile gloves. Right, I will discard that. Okay, put my kit together. So first I will clean with the Chlorhex solution that comes in the kit. Just snap these down. And then I will start closest to the central line. Scrub that. Then I will start working my way further out. And around. I'll be careful not to cross back into the section I've already cleaned. I don't want to contaminate that. And then I will also take whatever the facility calls to clean the actual line with. So I clean the line, let all that air dry. And then also at this time the end caps can be replaced or they can be cleansed with an antimicrobial swab. Right, and then once everything is dry, I am going to place the new dressing. Right over the center. I'm going to anchor it as well, the outside of the bandage. So that way we don't get any movement of the central line. a couple pieces of tape. Start in the center. Make sure it is around. Okay. Then I'm going to peel the white part around the dressing off. Okay. And then once all of that is done and the dressing is totally covered, the central line is no longer around any room air, it's not going to get contaminated, we can remove our gloves and our protective equipment, remove our mask. Then this little sticker, we will put our initials, the date, and the time. And we will, when we last changed it, and we will not put it right over the area so that way we can still keep an eye on it. And then we will report to the physician or the charge nurse if there's any complications, any big changes, anything that's concerning to us. And then at the very end, of course, provide patient safety, make sure the bed's back low, call lights within reach, the brakes are on, side rails are up, hand hygiene for the last time, and then once we leave the room, we will document the dressing change.